now is the time to answer some common health questions. Joining me is News Channel 5's medical expert, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks so much for coming in and stopping by today. Enterovirus, we're talking about that, and the flu. How do you know which one you have?
Yeah, well, it's very difficult, actually, and you cannot really tell based on your symptoms without a specific test, because with enterovirus, it starts off with fever, chills, myalgias, cough, congestion, sore throat, and so does influenza. So it's very difficult to tell. Now, the differences come maybe later on, where with enterovirus, you can develop some asthmatic type symptoms with bad wheezing and shortness of breath. Risk factors are a little bit different as well. For enterovirus, it affects the very young. With influenza, typically those that are high risk are elderly, whereas with enterovirus, the older patient population do not get it. So the bottom line is that these are viruses and that there is no cure. The best thing, as always, is preventative measures. So make sure you're washing your hands frequently, make sure you're using hand sanitizer, especially when you come in contact with public surfaces, and we'll do our best to minimize spread throughout this flu season.
All right, let's talk about strokes. It seems like more young people are having them. What's up with that?
You know, it's very interesting, actually. There has been some research done that show that younger patients are having more strokes. The NIH just published a study that showed that patients younger than 55 over the past decade showed an increase in the number of strokes from 13% to 19%. So that's an interesting statistic, especially in the face of elderly patients actually going down or decreasing in their number of strokes. Now, we don't know exactly why, but we're thinking because the contribution is high-risk patients, and those numbers are increasing with hypertension, diabetes, and obesity. So we're seeing more and more of those in the younger population, and thus we're seeing increased strokes. The good news, though, is that with better education on symptoms of stroke, with better imaging techniques, and with better treatment, even those of us in our patient population that are young and have had one are having better outcomes and returning to normal lives.
I'm no doctor, but I bet stress plays a part in that as well.
You always got to include stress.
Yeah. Dr. Soria, thank you so much for coming in. If you have a question for the doctor, you can send it in by going to our website, WPTV.com. Click on the health link, scroll down on the right. You're going to see a form, and right there you can write your question. Again, a pleasure to have you here. We'll see you next week.